All right, chiropractors, welcome back. So we're going to keep on the theme of how do you grow your chiropractic clinic, right? So we've covered a bunch of topics. If you haven't been with us, you can go back to my page or look up the podcast and get the information, right? But today, what we're going to talk about is how to grow your practice through retention, okay? So a lot of people struggle with retention, and they struggle there for multiple reasons, okay? And we're going to cover some of those reasons today in the 30 minutes that we have. So this is a problem for a lot of chiropractors. Like, they get some new patients, but they don't retain them over the long haul, right? And a lot of them have piggybacked off knowledge of previous chiropractors, and you hear me talk about that all the time. Rather than looking at business principles, the Goliaths in the business world, what do they do to keep customers, right? What do they do to keep people around? And so I'm going to encourage you, stop taking advice from other chiropractors, start taking advice from business people, number one. And even when it comes to patient retention, it's the same thing. Customer retention is patient retention. It's the same thing. Here's the main things that I see, right? So I've talked to hundreds of chiropractors, and nearly all of them struggle with patient retention long term. Here's why. Most chiropractors, and you need to go to let me stop for a second. Before you watch this video, you need to go watch How to Grow Practice Foundations, because that's going to give you kind of the preface of information that you need in order to be ready for this video. But I'll cover just like a really short segment of it. But I highly recommend, in order to get a better explanation, you go watch that video first. So most chiropractors are writing the wrong plan length, the wrong plan frequency in order to actually retain patients. And the equation that they're making in their head is time in the room with patients equals retention. All of that is wrong, right? I don't care what you've heard from other chiropractors, unless they've had a $6 million clinic, right? Unless they see 1,000 patients a week at a dollar visit average of $125 a patient visit, and they have outcomes at greater than 99%, and they have a dropout rate that is less than 3%, they don't know as well as I know. And I know that sounds egotistical, and I'm sorry for it, but it's true. Like, the numbers don't lie, okay? So plan frequency, plan duration, and then also how long you spend in the room. All right, so let me debunk number one. Number one, plan frequency and duration. Your job as a chiropractor to these patients is not to get them out of pain fundamentally. That's not how you should think about it, okay? So what the patient is going to think about is, this guy's here to get me out of pain, or this gal's here to get me out of pain. But that should not be what you are aiming at, nor what you are explaining to your patient. What you should be explaining to your patient is that pain is a result of dysfunction, right? So what happens, and this is, I'm going to give you literally like a secret that you can use in your report of findings and with your patients, okay? This usually comes in like our full training, but I'm going to give it to you. So, because I don't know how else to explain the topic. So frequency and duration, right? So pain looks like this. Pain is a bell curve, okay? So it looks like this, right? So at the top of the bell curve, right, the highest point, that's the most pain, and that's also the intervention point, okay? This is where patients say, I've had enough and I'm going to do something about it. At the bottom of either side of the bell curve, let me get myself on screen. On the bottom of either side of the bell curve, this is no pain, right? Now, at the bottom of the bell curve, this is also full function, okay? So biomechanically, physiologically, full function at the bottom of the bell curve. That's why they're not having pain. As they transition up this bell curve, right, there's an imaginary line that goes through the middle of it, right? As they transition up this bell curve, what happens is they cross what I call the pain threshold, right? And as they go up the bell curve, they're piling on dysfunction, right? So they have full function at the bottom. As they come up, they're getting more dysfunctional, right? And you know that this is how physiology works. You know this is how biomechanics works. I'm just putting it in a simple explanation. So dysfunction starts to happen, right? They start to have like hypolordosis, right? Or they start to have forward head carriage, or they're in phase 2 degeneration of their C6, C7 cervical spine, right? Or they're having some osteophyte development, or they're having they're having some muscular tension out of all of that, right? They're having some headaches, but they're really sparing, right? That's like all stuff that's happening on the lower side of that pain line, right? So the pain line goes through the middle, right? At the top is intervention, full, like highest level of dysfunction before intervention, and the bottom is full function, okay? So they're climbing up this dysfunction ladder, they're moving up, they're increasing dysfunction, and they're starting to develop biomechanical changes in their body, right? So if it's a dentist, right, what's happening is they're looking over all the time, they're doing this, right? They're like working on patients, looking down all the time. So if the dentist is doing that all the time, what's happening underneath the surface before that dentist has neck pain and potentially headaches? Well, they're starting to get forward head carriage, right? They're getting that anterior head carriage. They're training it in. And the dentist will do that for a while before, and they will have no pain, although they will have forward head carriage, right? And then eventually they'll cross that pain line, and that's their body saying, hey, right? We're having a biomechanical issue here. We're having a functional issue. You need to do something about this, right? And as most patients do, they ignore it, and then they get to the top, right? So they get to the top and finally like, I'm going to intervene with this, okay? What is the duration of that happening? Well, for some people, it's 20 years, right? They've been beating their body up for 20 years, but they don't have like consistent pain. So it took them 20 years to just get up this like little part up to the pain threshold where they start having pain regularly. And for some people, it could be 3 weeks, right? It just depends on what the person's doing and what's going on. So what's happening is they're going up this bell curve. They cross the pain threshold. They ignore it for a while until they can't ignore it, and then they intervene with it, right? Now, what happens, they start getting treatment and you start helping them, and you start to drive down their dysfunction and increase function, right? That's what you're doing when you're doing an adjustment and rehab. You're increasing their function, so you're driving down their dysfunction, and they cross below that pain line again, right? So they drop below, and it's like you're happy, they're happy, everybody's happy. Because why? Because they're out of pain, right? They don't have pain consistently anymore. So what do most chiros, most patients, most doctors do? They stop treating the patient, right? And so what's happened is they have this line, right? And they've dropped them just below this line, but there's about this much gap of dysfunction left in, right? Well, what got them into trouble in the first place? That much gap of dysfunction on this side, right? Before the pain made them aware of it. And so what's happening is we're getting them below the pain line, but we're not fully restoring function, right? And this is where most chiros are discharging their patients, right? And then they're wondering, well, shoot, why is Mary Smith, she keeps coming back every, 2-3 months, maybe every 6 months, and she's back in pain. Well, because you're not solving this gap physiologically. You're not solving it. You're allowing it to remain. And most likely it's not because you don't know it's there. Like, it's there, but it's hard to explain to the patient, when they don't have pain as a motivator, why they should continue care. I just gave you the explanation, right? This is the explanation you can use with your patients. And so what ends up happening is this to be true. And so you sell them these little baby plans that just drops them right below the pain line. And then Mary Smith feels good for a month or two, and then she's back in pain again. And so then she comes back to you, and you do a little plan, and you get her below the pain line, and you do this back and forth. Until what? Until Mary Smith stops coming to you. Why does Mary Smith stop coming to you? Because Mary Smith believes that you can't fix her problem, right? She doesn't think that you can fix it. Why does she not think that you can fix it? Because her pain keeps coming back, right? Like, her pain keeps coming back. She thinks that it's above your pay grade. Is it true that it's above your pay grade, though? Absolutely not. It's not true, right? It's not true. What needs to change in order to give her a longer-term result? More frequency, more duration, right? So the example that you can tell patients, and once again, this is just like a little tip, right? So it's like, if you're trying to explain this to patients, draw them the bell curve, help them understand, right? This will help you be able to get them onboarded onto optimal packages, frequency and duration, 3 times a week, 12 weeks, discharge when they're full function. But it will also help the patient understand the importance of it once their pain has been significantly reduced. Remember, you are not trained to just treat pain. You are trained to improve function, and the byproduct of that is pain relief. Don't forget that, okay? Some of you know that, and you're like, Caleb, stop stressing this, bro. But some of you have gotten lost, right? And so I'm trying to pull you back on the bandwagon, right? And this will help your business ultimately. So what do you tell Mary Smith when she's like, but I'm out of pain? First off, you shouldn't have that conversation at that point. You should be telling Mary Smith this will happen in the beginning, right? Before you even start. Because if you don't tell her, until then, what it's going to feel like to her on the other side is you're trying to just get her for more visits, and you're just trying to pump her for cash, right? Do not do that. Do not tell her once it happens. You need to preface it with this. And then when she brings it up, then you can say, remember when we talked about this, right? Okay. Number one, you shouldn't be discharging her that fast anyway, right? There should be some care that's ongoing even when pain has been reduced. But in the instance that for some reason that happened, You've already talked to her about it. She already knows what to expect. Now, what are the examples you can use for that, right? So number one, draw them the bell curve. Just draw it out for them. Show them. People believe what they see. Show them what it is, okay? And just be like, listen, you're going to reach this point over here. You're going to be out of pain. You're going to be like, doc, I'm done. Like, my motivation is gone because I don't have pain anymore. But if we don't solve this, what got you in trouble in the first place? And they'll be like, oh yeah, that got me in trouble in the first place. You'd be like, absolutely right. And you back it up with x-ray evidence, right? You're like, you see this forward head carriage? That started here, right? If we don't fix that to the as much as we possibly can, you're going to be back in pain, and we don't want that. Otherwise, all this is going to be for nothing, right? Patients get it. The other example that you can use is, let's say you can use them as an example. Let's say, all right, Mary. So let's say you decided that you wanted to get fit, right? You wanted to get in shape, like very in shape. Summer's coming. You want to go to the pool. You want to be looking good. How many times a week are you going to go to the gym to do that? And Mary Smith's going to be like, one of two things is going to happen. She's either going to say, I don't know, 5 times a week, 4 times a week, right? The other thing that they're going to say is, I don't know. And you just say, don't give them the answer. Say, take a guess. How many times a week do you think you need to go to the gym in order to get in shape, right? And what will happen is they will self-admit what they need for frequency of care, right? They will say, well, I don't know, probably like at least 3 times a week. And you'll say, absolutely. That's exactly what I'm asking for you. Why 3 times a week, Mary? Why can you not go 1 time a week to the gym and get in shape? And she'll be like, well, because it's just not enough. You'll be like, that's right. And then you can just say, listen, all these things you have going on is no different. The physiology is the same as when you're trying to make changes in the gym, okay? It's the same thing. It's bouts over time, right? And so now the patient has admitted to you that they need to come 3 times a week. You haven't given it to them. You've just asked questions, right? Next thing is duration. Be like, okay, Mary, so we agree. You need to go to the gym 3 times a week. How long are you going to go to the gym? Like, how many weeks are you going to go to the gym before you expect to be in shape? And what'll happen is a lot of patients will be like, well, probably like a year, or they'll be like, well, I don't know, like maybe like 5 months. And they're almost always going to overshoot your 3-month mark. Okay. And so if they overshoot it, they're like, my gosh. And they're like, well, I'm pretty heavy. Probably like a year. Then you'll say, well, the good news is I don't need to see you for a year to fix this, but you might be right as far as the gym goes, right? So I need to see you for 3 months, right? It took you a long time to get here. All that pain, all that dysfunction was happening before you were aware of it, before you had pain. And it just takes some time to unwind it, right? It takes some time to get back to normal, just like it takes time to get fit. And they'll go, oh, well, that makes sense. And be like, yeah. And so then you just say, and we'll reach a point in your care where you feel a lot better, like where you don't have as much pain. And that might be 6 to 8 weeks in, but we can't just stop there, because that'd be like you trying to get, to your fitness goal and stopping when you're not at your goal, right? And our goal here is we don't want to have pain for the long term. Be like, I don't want to see you for the rest of your life for this. I want us to be aggressive in the beginning, and I want us to solve this thing, right? And then we can just do some maintenance, right? It's no different than like if you get in shape. It's a lot of work to get in shape, but it's not so hard to maintain it once you get in shape. You have to do some maintenance, right? But then maybe you can go to the gym, 1 time a week, right? And just be like, we won't even need to see you 1 time a week to maintain it. And Mary Smith will be like, wow, okay, yeah, that makes sense, right? So what you guys are missing for the retention and frequency problem, or for the retention problem as it relates to frequency and duration, is number 1, probably just the guts to sell them a big plan. Like, can we just be honest? Number 2 is how to convey the information in an understandable manner. You need to know that the reading level of the United States by average is 5th grade. All of the, they did a study on that for like a legal purpose. I can't remember the study, but if you type it in like Google, like average reading level of the United States legal, it'll bring up this study. And what they concluded is that it needs to be written at a 5th grade level. Otherwise, they will be talking over some people's heads, and then the people won't know what they're agreeing to, okay? And I know that you've seen some legal paperwork from like private lawyers that are a little like convoluted. And I can't remember for sure if it's legal, but I know that you need to dumb it down. There was a study done, and you need to communicate at a 5th grade level. I believe that it was legal though. So when you're explaining to patients, I need you to get all the technical garbage out of your conversation. And you need to use metaphors, right? The bell curve, right? Working out. The patient needs to self-admit it, right? And then what will happen is you'll be able to get plans that are the right frequency and right duration for these patients, and they'll understand and they'll buy into it, all right? So that's just like hardly, and that's like a sliver of information on how to like make sure that patients start care and are compliant, all right? So frequency and duration, that's a huge one. They need to understand it so that they complete it. The next thing that it is how like time in the room, like how you're going to educate your patients. All right. So I'm probably going to ruffle some feathers with this one. All right. So just know that you do not need to spend more than 10 minutes in the room with a patient. Okay. You just don't. It's unnecessary. If you were to actually look at what you're doing in the room at that time, like step out of yourself, third person view, how much of that time is wasted for those of you who are spending 20 minutes with a patient? And I mean like wasted, like you're putting in effort, but you're getting diluted returns on the back end of it, okay? So what it should take for a patient is 7, I would say maybe even 5 to 10 minutes. That's your sweet spot, okay? And what's happening for some of you that are having longer visits than that is you're spending time doing things that are not worth the investment. And I know that sounds horrible because you're like, well, this is a person, it's worth the investment. Here's what I mean. Let's say, because you have to bring it back to reality, right? And yeah, in La La Land, we have unlimited time, right? But in reality, it's like you have 100 patients, right? So let's back it down. Let's say you have 20 patients, okay? And you can see 20 patients in a day. And so you can help 20 people, right? And you can give each one of those 20 people, let's say 20 minutes, whatever that is. I didn't do the math, but let's say 20 minutes. And so you can help 20 people maximum, and you're running around like a crazy man or woman helping 20 people, all right? But the extra 10 minutes of time that you're giving is giving little result, right? It's like, it's a diluted result. Now, let's say you cut it in half and you do 10-minute visits, and now you can see 40 people, and you're giving 40 people 95% of the results. Where is the greater good? And I'll have to argue that the greater good is to do the 95% for 40% of people, because the 5% is going to get whittled away anyway through frequency and duration. So the frequency and duration is solving multiple problems. It's solving the problem of retention long-term because they understand, right? They understand the importance of it, but it's also solving the problem of you don't have to spend as much time giving treatment that is diluted for results, right? Because you have more visits. And so since you have more visits, that 5% goes away because you're not trying to give them everything in 8 visits. You're trying to do it over 36 visits, right? And so what that means is your visit length can come down. And what that also means is that you can see more patients. And so you can give, like, if we're going to say 100%, every patient, 40 patients get 95%, that leads to 100% over time, right? Versus you can give 20 patients 100% over 8 weeks, and then they're going to fall back into pain anyway, okay? So you have to get over like the guilt of not doing the little things that are going to be like 1, 2, 3% improvement. And you have to make everything in this world is, you know, blessings, curses, rob Peter, pay Paul, right? So you have to rob Peter a little bit so that you can pay a bigger Paul, right? So that you can help more people. So that instead of just doing 1 Mary Smith every 20 minutes, you can give 2 Mary Smiths time back with their grandkids, right? And how you do this in the room is very simple. You need to train the patient on what to do, right? So you're going to train the patient when they come in, they need to lay down, right? You're going to do your assessment. You're going to do, your assessment. And then you're going to be asking questions as you're working on them. You're not going to stand face to face like this and ask questions. It's going to be a work in progress, okay? So you're going to check them in, start your note, whatever. Have them lay down when they come in. They should be trained to lay down, get ready for you. Then you're going to do your assessment, and then you're going to adjust them. And when you adjust them, you're going to ask them every single time for feedback, okay? You want feedback because this is what is increasing the patient experience, increasing your knowledge without taking more time. So it's like, all right, I adjust that, I did side posture. How did that feel, right? And if the patient tells you something good, you want to affirm that. Be like, oh, good. Yeah, that felt like that was good. If they tell you something bad, and it's not like out of the norm, right? It's like, oh, well, you would expect that, right? Patient comes in, they're super locked up. It kind of hurt to give them an adjustment. You need to normalize that because it is normal, right? If I have like super locked up SIs and someone goes to try to do a side posture, it's not gonna be super enjoyable to me in the moment, right? But what the provider should do is they know that that's normal. And so they should say, that's completely normal. This is why, right? Because otherwise in their head, they're freaking out about it. That's normal, here's why, right? Adjust, that's normal, or good, here's why. Normal, good, here's why. Normal, good, here's why. Once in a while you run into one that's not normal, and you do need to explain to them why it's not normal and what your plan is to fix it. So then you're going to adjust them, right? And then you're going to, as you're getting them up, you're going to ask them, how do you feel, right? You want them to affirm that they feel better. And then you're going to basically like tell them what to expect in the future, right? Because every human's fear is fear of the unknown, right? So you say, okay, Mary Smith, so I'm glad you feel good. I'm glad that went well. Here's what you can expect going forward, right? You can expect that you'll feel better for the next couple of days. You might start to feel that it gets a little bit tight again, but that's okay. We have an appointment set. We're just going to work this thing out, all right? And then you're going to shake Mary Smith's hand or do whatever. She's going to go on her way. You're going to finish your note in the room, right? You're not going to put all your notes to the end of the day. You're going to finish your note in the room so that at the end of the day, you're done. And you're going to get the next patient in. And that's what should happen. It should take 10 minutes, no more than 10 minutes. You're going to just be adjusting patients, okay? And the difference between that and some of the other things is, a lot of you are having patients come in, they're staying at the doorway, you're having conversations, maybe about their pain, maybe about the game, maybe about the news, maybe about whatever. And then you instruct them to lay down. And then you do your assessment. You're talking about BS while you're doing your assessment. And then you're adjusting them and you're still talking about BS, right? You're not focused on them. And then they get up and then they want to chat because you've gotten them on this track of BS chat, right? That's not what you should be doing. It's focusing on them in the moment and their functional goals. I forgot to say that in the right example. So when that patient gets up, like Mary Smith gets up, you want to affirm why you're doing it every time. We're doing this so you can chase your grandkids. We're doing this so you can chase your grandkids. We're doing this so you can chase your grandkids. We're doing this so we can chase your grandkids, right? And many of you are not even doing that, even though you're taking 20 minutes, right? So there's a lot of BS talk that's going on in the middle of it. That shouldn't be happening. It should be a system, right? And you just follow that system every single time. It should be really poignant. It should be really focused. It should be all about their care when they're there, all about their goals when they're there. BS should not be in there unless you have a gap in your schedule, right? And you really don't even want to do that anyway, because then those patients come to expect it. And then when you are busy, they expect you're going to stand there for 10 minutes and BS with them, and you got 3 patients waiting on you, and that's an issue. So whatever you train the patient is what they're going to do, okay? So you need to train them from the beginning. Mary Smith, you're going to come in. When you come in, you're going to lay down, right? You're going to assume the position. You're going to lay down. And then you're going to talk to them as you're adjusting them, right? Then you're going to get them up. You're going to ask them how they feel. You're looking for information. You want them to tell you what they're feeling, good or bad, right? If it's good, you want to affirm that back to them. Say, great, we're well on the way to you chasing your grandkids. If it's bad and it's normal, right? And it's normal, keywords, you want to give them a normalizing explanation. If it's bad and it's not normal, then you need to explain to them what's going on and what you're going to do to fix it, okay? That's the sequence. If you do those 2 things, if you explain the plan correctly, right? And we have a complete report of findings training. The report of findings starts when your external marketer talks to that person for the first time. That's when it starts, okay? So correct sales process, right? External to consultation, to x-ray, to second day report of findings, correct report of findings script, correct explanations, correct closing, correct explanation, right? So when you follow the right thing and we have all that training, then what you'll have is you'll have patients that convert at 80% consistently, right? They start care, full care plans, right? 36 visits, 70 to 80%. And because you've pre-handled the whole I'm out of pain thing, they will stick on your care plans. And because every time you come in, you follow the same routine, right? Because people are creatures of habits. They want to know what to expect. Follow the same routine, right? 10 minutes, you're not taking too much of their time. You're not taking too much of your time. You're really poignant. You're focusing on their goals. You're focusing on what's going on in the moment. And then you cycle them out. What will happen is you will have less than 3% dropout, and you will have 70, 80% people starting on plans, and you'll have completion, and you will also have patients that now trust you because they're like, wow, I'm still pain-free a year from now, right? A year from now, I still don't have any pain. I go in once a month and get kind of tuned up, but I feel great. And that's what they're going to tell their friends, right? And then their friends are going to come in off of that credibility. So that's how you grow your practice, through retention. Those are some of the concepts, right? There's a lot more concepts, but this will get you moving in the right direction, okay? Some of you are going to be hesitant to changing the way that you do things, and I would just ask you, like, what are your goals here, right? What are your goals? You want to see as many people as you possibly can because you want to help the world, and you want to make a profit when you do it, right? Because you're working hard, and you want patients to get really great outcomes, okay? When you compare what I said compared to what you do, is there anything that you can take from what I said that has been proven, like the stats don't lie, that you can use to improve your processes? Like, and I know some of it's like an ego thing. I get it. Like, ego gets in the way for me too sometimes. But there are some things that you can do to improve, right? And I would ask you just to try it. Try it for a month, right? And not half-hearted. Try it for a month and come back and let me know that it didn't work. But I know that it works because I've done it over and over and over and over and over and over, and it works every single time, okay? So that's it for today. I hope that helps your patient retention and helps you grow your practice. Otherwise, I'll see you next time.